All right. With that, I think I'm going to turn it over to Elizabeth and let her get started. She is the supervisor for our Northern Utah offices, and she's awesome. So I'm going to let her get started.
Thanks, Heather. Today we'll be going over resources and support for substance abuse. We're going to start with just talking about what substance use is, kind of what that means, especially if you are someone that has someone you care about that is struggling with substance abuse or addiction. And then we're going to go into some resources available. I'm not covering every resource that's out there because there are so many, but I'm hoping this will get you started. And if there's a resource that you want more information about, don't be afraid to let us know at Blomquist Hale, because we are happy to help you find those resources. So to start off, where am I coming from? What's my experience with this? So I worked on the Green Dot Community Grant and Community Tobacco Grant in Alaska. Green Dot is a community grant that focuses on community needs. It just so happened Alaska's community need was alcohol, substance abuse, and domestic violence. I was a tobacco cessation therapist and a Prime for Life instructor. Prime for Life is a course that's taught about substance use and refraining from substance use. It's often used for first-time DUI or first-time marijuana offenses. I'm also a currently certified and licensed substance abuse professional. So that means I do assessments for the Department of Transportation. So that would be FAA, that would be FTA, FMSCA, anything under the Department of Transportation. I do the assessments for if they fail a drug test. And I've also been a mental health therapist for 13 years, including a lot of substance abuse treatment. So let's start off with what is addiction. This is the quick definition the American Society of Addiction Medicine gives it. And it really does capture it, but also doesn't. Addiction is a treatable chronic mental illness. It's also a medical illness. There are complex interactions among the brain, genetics, environment, and individual life experiences. But even though that says it all, it kind of doesn't talk about how hard it is to stop using. It doesn't talk about how much it impacts our families, our friends, our communities, our laws. It impacts so very much. It doesn't talk about just how scary it is to have a loved one that's really struggling with addiction. It doesn't talk about how much it can tear a family apart, how much it can break your heart, and how horrible the loss of losing someone to addiction is. So it's a really good definition, but I would say it doesn't capture it. Now, dependence is something a little different. Dependence is when your body has now chemically become addicted to a substance, and that's where you will have withdrawal. And so I pulled that definition from the National Institute on Drug Dependence. And it can be very mild, such as if you've ever had that day where you didn't get your Diet Coke or your coffee. That's actually mild withdrawal sometimes. If you're finding you get a caffeine headache, or you're finding that you're a little more irritable, we would actually call that withdrawal. Very mild withdrawal, not very concerning if it's caffeine. But then you have more life-threatening withdrawal. Heroin, opioids, alcohol. Alcohol is one of the most deadly withdrawals out there. And it can be so dangerous, so frightening. But your body at that point is chemically dependent on that substance. And so when you take it away, your body reacts very upset and can make you feel awful. Both these conditions are medical and mental health conditions. It is not a matter of will, but a matter of treating the symptoms. If it was just a matter of will, it'd be easy to say, I quit, I'm done. It's not. I can't just take something from your body and expect your body not to freak out. And I say that because there's still some belief out there that all they gotta do is just quit. I just gotta convince them to quit. I gotta show them how bad it is, how much it's hurting us, and they'll just stop. It's not that simple. It is more than a matter of will. Now, I'm not saying it excuses the behavior with addiction. I'm not saying that we shouldn't hold people accountable, but it is not simply just saying, I quit. So I did get asked when I was putting this together about behavioral addiction. Behavioral addiction is a thing. It's not the same as chemical addiction. So some of the common ones are shopping, spending, pornography, sex, internet, social media. There's some argument for being addicted to phones. It hasn't officially been categorized as behavioral addiction yet, probably coming. It does, just like chemical addiction, change our brain chemistry and how we respond to things. It is a legit addiction. There are treatment programs for it. There are resources. This particular presentation is going to focus on chemical addiction. Some of it will relate to behavioral addiction. If you guys do have specific questions about behavioral addiction, please let me know. I'm happy to answer. If you guys have ever done any sort of addiction treatment or ever been to one of those programs, you will see the stages of change. This is universal and used all over in addiction treatment. Basically, it works like this. Pre-contemplation is I am thinking that maybe there's a problem, maybe there's not. I'm not quite there yet. I haven't decided there is a real problem for me to think on. It's not really getting in the way. Contemplation's when we're starting to go, maybe this is a problem. Maybe I need to do something about this. Maybe it's getting in the way. Maybe this isn't healthy. Preparation is when you start to actually look at, okay, where could I go for treatment? Who could I talk to? It's sometimes telling a family member that I think I need help, sometimes telling a doctor. Different for everybody. And all addiction has its own unique features. Action is when we start getting into treatment, when we start making changes, choices, and getting help to get well. And that goes all through treatment and recovery. Then there's maintenance. Maintenance is maintaining recovery. So maintaining a sober lifestyle, maintaining no drug use, maintaining no addictive behaviors. Now, the reason there's still an arrow going back to pre-contemplation is there's that little gray box there that's not in the cycle, but sometimes slips in, and that's relapse. Sometimes after you quit or after you've gotten treatment, you slip up and you might go through this cycle again. Sometimes you don't go through the whole cycle. Sometimes you jump right into contemplation. Most will go through the whole cycle again. That pre-contemplation of, I relapsed, is there a problem? Yes, there's a problem, I need to get help. And that's why it's not in the cycle, but it could slip right in and you'd start the cycle again. Systems theory is something we use in social work to talk about when we're treating a patient that comes into our office. You can't just treat that one person. You have to consider their family and all the systems they are part of. This is shown in all kinds of different styles and graphics. This is just a really common one. Sometimes they'll have lines going to and from. Sometimes they'll have these in multiple categories. These are some of the big ones. Family, extended family, friends, community, work, school, our doctors, our culture, our environment, laws, policies. All these things affect the patient, the family. All these things are affected by the patient, the family. If you've ever read in the paper about someone dying of an overdose, it affects our community. If you've ever had someone at work that you've been concerned about their use and worried that maybe that might affect your job or the safety of the job or how they do their job, again, there's that relationship there. Our laws and policies are often affected by individuals, and they're affected by laws and policies. All these systems matter. We also know that these are things that can get in the way of treatment. If there's a law or policy that makes it hard for them to get treatment, they might not get treatment. Environmental stressor, part of their culture that maybe pushes a certain belief that doesn't work for treatment. Maybe school, it depends. But all these systems are something we have to consider when we're treating someone, but also when we're the family member, the friend of someone dealing with addiction. It's not just them, it's everything around them that has to be looked at. So some of the barriers to recovery, and they should be pretty familiar. Withdrawal symptoms, we talked about how bad that can be. Sometimes medical symptoms, including pain. So if it's someone that's maybe taking pain medication and has started abusing that, one of the things that can happen is if they're not using, they're in pain. They also might be denied medical care in the future because they reported that they abused their meds, even if it was just once. There's shame, there's guilt, there's doubt, there's fear that people are going to judge you for using. They're going to say that you're weak or that you're causing harm. They're going to associate you with something bad. It's scary. Cost. It's not cheap to get treatment. There are some treatment options that are cheaper, but it still might be time. It might be missing work. It might be time away from your family. There's a lot of cost, financial and otherwise. Fear of losing their job or missing work. For a lot of us, it's really hard to go, I need time off. How would I find an hour a week to go to treatment? How would I find enough time to go to a hospital to do a proper withdrawal? It's not easy. Legal consequences. What if I tell somebody that I'm struggling and I get charged with something? What if my family abandons me for this, or DCFS gets involved and takes away my family from me? These are very real fears. Responsibility for a person. Maybe you're a caregiver for children or an older adult or someone with disabilities. Maybe you have a pet that's dependent on you. Social pressure. It's hard to quit sometimes, especially for a substance like marijuana or nicotine cigarettes or alcohol. It feels kind of weird to be the one that says, I don't drink or I'm not drinking tonight, even very innocently. I know that I once was at an event. It was a work event, and I said, I'm not drinking tonight. And somehow within 5 minutes, at least 10 people decided I was pregnant. I wasn't. I'm not. I wasn't drinking because I was on call. I didn't feel the need to announce that. But it became a thing then of all these people spreading this rumor just because I'd said, I'm not drinking tonight. Such an innocent thing that all of a sudden became a big thing. Families will do this, friends. Sometimes they'll make a big deal of saying, well, it doesn't count. It's a celebration tonight. Or making people feel not included because they're not drinking. It's a real problem. Stress, trouble finding a treatment facility that meets your needs. Not all of us live in a big city where we can get to a treatment facility, or maybe we can't find one that takes our insurance. Maybe you need a certain kind of care, but you don't know what that level is. That's hard. And these days, sometimes you'll call and go, well, I need to get in. I need help now. And you'll get told, oh, there's a waiting list. It's so frustrating when you're ready. But there's all these things in the way. I will answer, since it's not in this presentation, fear of legal consequences. Legally, there are special protections for privacy for substance abuse. It cannot be reported to your work except under very specific circumstances. There are a lot of very special laws just for HIPAA and for substance use. Because we know that if there's going to be consequences for your job or legal consequences, that you might not get the help you need, or your loved one might not get the help they need because they're afraid of those consequences. So there's a lot of very special protections to make sure that that information is kept private. It's actually an extra fine and extra legal consequences for violating the privacy of someone who has a substance abuse disorder of any kind. Again, if someone has questions on that, please let me know. Happy to answer them. So these are just some informational resources to start with. The American Society of Addiction Medication, so ASAM. They also are the group that defines the levels of care. They provide a lot of the education and support for those of us that treat substance use or addiction. Substance Abuse Mental Health Services Administration, so it's called SAMHSA. I know it's a mouthful. They have a website with lots of information where you can actually find a treatment center in your area that meets your needs. You can search by insurance, you can search by level of care, you can search by what area you live in. SAMHSA is also the organization that has the hotlines for suicide risk, for veterans, for domestic violence. They're a wonderful organization. And I have included the link for where you can type in information to find a treatment center. The Opioid Response Network is a little newer. They're part of SAMHSA. They specifically focus on opioid addiction. And they provide resources and connection for those who are struggling with opioid abuse or addiction or dependence. Blomquist Tale has a YouTube channel. Like Heather said, we're recording this today and it goes on there for free. It is readily available to you and it's readily available to the public. You can also find all of our YouTube videos on our app, which is available on Android and Apple. And we do have videos on the science of addiction. We have videos on treatment. This particular video is on resources, but if you want more videos on this topic, you can find those for free. Supporter groups. Most of you have probably heard of AA and NA. So these are what are called 12-step programs. But it would be wrong to say that that's all AA and NA are. They're not just 12-step programs. 12-step programs are meant to be a support group to help you work through the 12 steps that they have to help you stay free of substances that you're abusing. There even are some for behavioral addiction. But they're also support networks. They're friends you can hang out with that don't use. They are sometimes exercise clubs, coffee groups. Sometimes there's someone that's going to call you up when you're struggling. They are much more than just a 12-step program. And there is really good research showing the benefit of a 12-step program. Now, they're not for everybody, 100%. Not everyone likes going to AA. But they're very welcoming environments. They're free environments. They do their best to keep things confidential. Family members are welcome to attend. And if you've never been to a celebration where someone gets their chip, it's a pretty special moment when someone earns their chip for not using. It's a big deal. And they also have a lot of resources. So don't be afraid to try them out. Again, if they're not for you, they're not for your loved one, that is totally fine. But they are a great group for a lot of people. I do get asked quite often, well, aren't those religious? Not necessarily. Al-Anon does have an aspect of higher power. They don't usually, I'm not gonna say that there isn't some exceptions, push any one religion. They're not supposed to. But yes, they will refer to a higher power. And then some people that makes them uncomfortable. But it is still a great organization. CRAFT, which here in Utah is connected with USARA, is a support group for families and loved ones who have someone in their life or had someone in their life that is struggling with addiction. And that is some of the terminology that you'll hear a lot of us in the treatment world use. We don't say you're an addict. We don't say you're an alcoholic. That's like saying that they're this one thing and they're not. They're a whole person. So we usually use the term, they're struggling with addiction. They're coping with addiction. They are dealing with alcohol because it's so important to help them realize they are more than that. And CRAFT is a group that really supports that mentality. They get together and support each other, whether it's active addiction or whether it's someone that hasn't used in a long time. They have coffee groups, they have meditation groups, they're available online, they're available in Spanish, they have in-person groups, they have peer support groups where you could have someone that just helps support you while you watch your loved one try to get well. It's a great organization. Now, local treatment centers do sometimes have support groups for families. So up here in Ogden where I work, Action Recovery, for example, has a once-a-week meeting for family members. It's free. It's just hosted by them because they do treatment in our community. Depending on where you live, you can probably find a support group for just family members. It's always worth checking with the treatment center that your family member might be going to, or even just a local treatment center that you know of. Do you have anything for families? And a lot of the time they do. These are groups where you can really get together and hear other people's stories, get ideas, get support find resources. Sometimes just hearing someone that gets it and isn't going to judge you for it or give you a bunch of advice that you don't want to hear or heard a million times helps. Sometimes it just helps us get through. So what does Blomquist Hale do for substance abuse? Well, we do referrals. We help with finding the right level of treatment and the right treatment service. We do some treatment at that lower level where people are pre-contemplating. We'll sometimes help people with substance or addiction. Most of the time, though, people are going to need something a little higher level than Blomquist Hale. For example, we do not have a detox program. We do not have an IOP substance abuse program, but we will help you find the right place to go. And we'll help work with you to figure out how can you afford it? Will they take your insurance? Is there funding available for you to help with that cost? We are meant to help employees and their families, so it doesn't have to just be the employee. It could be your son, your daughter, your mother. It could be grandpa that lives with you. We're happy to help you find what you need. And sometimes I'm just sitting there with my client who is maybe an employee or an employee's family member, and they're saying, you know, I have someone that doesn't have your benefit. I just need some resources. Where can they go? And we're happy to sit with you and help you figure out, here's where you could go. Here's what can help. Here's what you can do. That's what we're here for. Drug-free workplace and SAP assessments, we do those. So drug-free workplace is a policy that a lot of businesses follow, that they want to have a drug-free workplace. And so if for any reason an employee reports that they are struggling with a substance, or if they failed a drug test of some kind, they get to get an assessment and treatment instead of getting in trouble and getting fired from their job, because the workplace would like them to keep their job, but also wants to keep everybody safe. Not every workplace has these policies. Not every workplace contracts with us for these, but we certainly help a lot of workplaces with these assessments and helping get people well so they can go back to work without any problems. SAP assessments I mentioned earlier, I'm certified SAP. So those are Department of Transportation assessments. So truck drivers, bus drivers, train engineers. Those are under federal law. And so we help with those assessments and help get people back to work. Like get back to work drug-free. All of our services are 100% confidential. So if someone comes in for one of the assessments, for example, and says, I don't want you to tell my work, I'm not going to, by law. This is 100% confidential. Now, in those cases, usually we fill out a release of information that gives me permission to tell their work certain things. Like, yep, they're cleared. Nope, they're not cleared. Here's the plan. We still keep it confidential. None of these businesses have access to my records, to my assessments, none of that without the client's written permission. All they get is what the client is comfortable with. Resources and education. We offer as many resources and education as we can to help, whether it's someone that's struggling with substance abuse themselves or someone that just needs some education on how to help. We're here for that. Supervisor referrals is a wonderful part of Blomquist Hale. We sometimes get referrals directly from a supervisor who will call us up and say, hey, I have this employee, they are struggling with alcohol use, and I want to get them some good treatment. Can you give me a list of treatment centers that take Select Health Value Plan? And we help with that. Sometimes they'll schedule an appointment for that employee. We're happy to help with that. That's part of our service. Now, I will say with confidentiality, the only exception to confidentiality with substance abuse is imminent harm, and it does not mean that we can disclose the substance abuse. So if someone disclosed substance abuse, but no one's going to get hurt, I have no right to share it with anybody under any circumstances by law. Now, if someone tells me that, for example, they are driving with their children drunk today, by law, I do have to report. That's called imminent harm. That very rarely happens. But substance abuse has very specific laws that protect confidentiality because we want people to get help. Medical and mental health. So medical providers can provide a lot of support with treatment, providing medical care, and also making sure that someone's getting the right care. Substance use, unfortunately, causes a lot of medical issues. Heart issues are very common. Sometimes issues with damage to the bloodstream or veins. Sometimes infections from needles. Sometimes stomach problems from certain pills. Sometimes problems with the nose. Lots and lots of things. And so having your medical provider on board and knowing what is going on helps them provide good treatment. I'm always encouraging my patients to be as open as you can with your medical provider. If they give you a med that doesn't react well to a substance you use, you could get hurt. And most of the time, they can help you with resources. They can help you with getting to the point where you are ready to quit. They might not be able to do it all, but they might even be able to point you in the right direction. Mental health services can help treat more than addiction, because sometimes addiction really is tied heavily into mental health, stress, depression, sometimes struggles with severe illnesses. You can't just expect the addiction to go away if there's also another problem that you need help with. And that's one of the parts of mental health that's so important with addiction treatment. Detox is sometimes necessary to help ensure a safe transition. Talked earlier about that chemical addiction and dependence. So sometimes detox is necessary, and that can be at home, that can be at a hospital, depends kind of on your insurance and what area you live in. But making sure that when you quit that substance, or when your loved one quits that substance, that it doesn't have side effects that could kill or cause permanent harm. There's services like Suboxone programs. That's a program to help someone quit opioid and other painkiller kind of substances. Parent-friendly programs. So I've worked for programs that have a mother's unit. So young moms, or I shouldn't say young moms, moms with young children, and attend with their children so that they don't have to worry about finding a babysitter or worry what's going to happen to my child while I'm in treatment. There are programs like that. I know of one in Utah. I know of a couple in Wyoming. Kind of depends on your area, but if that's something you're looking for, we're happy to help you find it. We know that if a parent is separated from their very young child, that can be detrimental to treatment. Online programs, weekend programs, payment plans, really depends on your insurance and where you're at. And so all you gotta do is figure out what would help me or help my loved one get there, and then look at what's available. You don't know until you ask or look. Community resources. So Rough Haven is a wonderful organization here in Utah who will look after someone's pet while they're in substance abuse treatment or in a domestic violence shelter. Unfortunately, that is one of the barriers to not just substance treatment, but also domestic violence. If I can't take my dog, my cat with me when I go to treatment, what could happen to them? Rough Haven even has a wonderful contract with Odyssey House, for those of you that are in Salt Lake, to help provide that support. Wonderful organization. Local county health departments. So depending on where you live, most local county health departments have funds put aside for substance treatment, substance support. And so depending on what county you live in, it's always worth looking what's there. What do they have available? Especially since it tends to be low cost or free. Some places have workplace programs. One I haven't mentioned is the Utah Professional Health Program through DOPL. If you're a medical professional in some way, this includes doctors, techs, nurses, veterinarians, dentists, and you struggle with substance abuse, or a loved one of yours is in that field and struggles with substance abuse, there's a special program through DOPL to help ensure that you get good treatment, don't lose your job, and that your license doesn't go away. It is anonymous. It is not reported to DOPL. DOPL is just over the head of the program. And it's a way to get treatment because there is special needs if you are a medical professional. You can't just go to any treatment facility. You might run into your own patients there if that was the case. And you also have a different set of knowledge. So it's a wonderful program. If it's something that you need more information about or a loved one needs more information about, please let me know. Drug-free workplace programs already mentioned, and SAP programs. I'm also going to mention the Tobacco Quit Line. Tobacco Quit Line is funded by tobacco reparation funds, and it supports helping people quit tobacco or nicotine products. So this includes vapes, snoods, chew, all those various programs, orbs. They can provide NRT, which is nicotine replacement therapy. So that's the gum or lozenge, Nicorette. Sometimes medication. They help with counseling and coaching to help people quit nicotine products. It's a great organization. It doesn't cost you anything to use. Talking to kids about addiction. When a kid is born, so baby, they are already able to sense when something's wrong in their family. When I say wrong, they can sense stress, tension, depression. And this is kind of a safety feature in all humans that we are born with. So even a very small infant can sometimes be agitated when someone's struggling with mental health or addiction. One of the things that's really important is to work with kids on understanding what's going on. You don't need to tell them everything, but if you don't tell them, they're going to guess. And if they guess, it can sometimes be a scarier thing to them than it really is. A lot of common questions kids have is, when is my parent, when is my uncle, when is grandma, when are they going to be well? Why do they do what they do? How can I help? Will they get better? These are important questions to a kid. And it's not always easy to have the answers. There's a lot of resources out there for that. One I've included is Sesame Street Workshop. They have a lot of stuff put aside for hard topics for preschoolers. If you ever watch, I want to say her name's Carly or Kari, she's a green Muppet that's on Sesame Street whose mom went into addiction treatment and Carly went into foster care temporarily. I find that a lot of preschoolers, if they don't understand what we're telling them, can at least relate to characters on Sesame Street and learn something from it. There's lots of topics. Parental addiction is the one I included here, but also trauma, mental illness, physical illness, moving, violence in the community or in the media. These are hard topics to discuss with anybody, let alone a preschooler, but they still have questions. So a wonderful, wonderful resource. But yes, my advice would be, don't deny what's going on. Don't hide it from children. Find a way to help them understand so that they can feel secure, safe, and not anxious. Odds are, if they don't feel supported or that they understand what's going on, they're gonna act out, they're gonna get anxious. One of the worst cases I ever saw was a young lady under 10 who developed severe ulcers from worrying about her parents' substance use. Unfortunately, her parent did struggle very badly with alcohol. And really what it came down to is answering her questions, because she was very scared of what it could mean and couldn't get the answers she wanted. It really is important. I would also say it's very important to make sure that children are safe in the home. If there is someone that is using in the home, it's very important to make sure they don't have access to needles, to substances, to alcohol, any of these things. Accidental overdoses are preventable, and because children's bodies are so small, if they accidentally ingest or touch certain substances, they can get very sick or even die in a way that wouldn't happen with an adult. So it is really important, if there is something like that happening in your home, to make sure children know not to touch, that these things are kept out of their reach. In-home resources, so having a Noxalone or Narcan in your home, I'm going to go over that in a little more detail. Disposing and storing medications properly, so you can dispose of medication at pharmacies, police stations. A lot of us are just in the habit of, once we don't need a medication anymore, just keeping it just in case. And one of the unfortunate things for people struggling with addiction, particularly to prescription meds, is checking people's cabinets in their bathrooms or other common places where we keep meds and abusing them. It's really unfortunate. It can get people hurt. One of the things that really helps is making sure that they're stored out of reach, and that when you're not using them, you dispose of them properly. I have had cases where people have even looked at people's trash and things like that, needing to get that medication for themselves because of their addiction. And so not always acting the most rationally and doing things that we wouldn't think of to get their hands on it. I've certainly had cases where people have swiped medications from a friend's cabinet that they just were visiting. So it really does help to make sure that you're storing these in a place that's safe and not keeping them when you shouldn't have them. Keeping any substance or materials that trigger addictive behavior out of reach or out of the home when possible. It's really hard to quit if someone else in your home is using. So maybe you're married to somebody who's struggling with an addiction. Maybe you have a good friend or family member or roommate. It's really hard to say not be drinking if everyone else is drinking. It's really hard to not use marijuana if everyone else is using marijuana or someone you're close to is using marijuana. So it is something to consider if it's someone you care about, how you can manage that so you don't make it hard for them. Sharp containers and proper needle disposal, whether you're in a home where you have needles for medical reasons, or it's a home where someone is using and doing injections, making sure that you're disposing of those appropriately. It makes sure that everyone stays safer. Healthy boundaries with clear and realistic expectations. Boundaries are so important when dealing with addiction. They need to be clear, they need to be voiced, and they need to be realistic. And that can be hard. And that's one of the great things to work on in treatment for yourself as someone that loves somebody that's dealing with an addiction, is how can I set these clear and realistic? What is realistic? Sometimes it's not realistic to say, I need you to quit right now, or you're out of the house. That hard love can work. It can also backfire. Sometimes that is when they just walk away and continue to use or get more sneaky about it. Sometimes they decide, well, okay, then it's over and I'm going to lose you anyway, so I'm going to be more careless. It's going to be more dangerous. So you want to be careful about clear, realistic expectations. Hard love does not always work. And being supportive and kind to your person, whoever they are. I'm not saying it's okay for them to use. I'm not saying you have to agree with their habit or support their habits. Being kind. One of the problems with addiction is it feels good for people that use. And so if my family, my friends, my workplace, these communities, these social systems I'm part of, don't like me the way I am, I'm not going to engage in them. I'm not going to have a reason to quit. And so it is important to still engage, to still be kind and supportive. Again, not supportive of their behavior, but supportive of them. So what is Narcan? This is just a quick definition, but in a nutshell, what it is a medication that you can give to somebody who is in the midst of an overdose on an opioid, and it can save their life. It reverses the effect of the overdose. There's a lot of different opioids. Fentanyl is probably the one that we hear about the most right now, but there's others. If you give someone Naloxone and they're not ODing, it will not hurt them. It is not an opioid, it is not addictive. It is something that can save people's lives. If you have someone in your home or someone you care about that is actively using an opioid, it is good to have because it can be the difference between life and death. Now you can get Naloxone at a pharmacy, county offices, the CDC. I've included a website where you can look for where you can pick that up. And there are trainings on how to use Naloxone. It can be a little intimidating. Some of them are injections. They also have inhalers. So ones you can just breathe in. But again, this can be the thing that can keep that loved one alive so they don't die of an overdose. I'd love to tell you that an overdose, surviving it will always stop someone from using. That's not always the case. but no one can stop using if they're dead. And that's why Naloxone is such an important tool. And these are just references to some of the resources that I talked about. And I did want to make sure I left plenty of time for any questions at all about addiction, about resources. I've turned off my share screen, so you guys cannot see anyone's questions. If you guys want to message them to me, I'm happy to read them. I will not tell who you are, but you're also welcome to unmute yourself and ask out loud if you prefer. So if anyone has any questions, comments, or thoughts, I am absolutely open to them.